This is the hip scoring test. For this test, the patient is going to be lying in a supine position, and I'm going to be standing to the side of the involved side of the patient. For this test, I'm going to take the patient's involved leg and fully flex the hip and knee while providing an axial load down the femur to compress the joint surfaces, also while internally and externally rotating the hip and even moving it into abduction and adduction. A positive test would be increased symptoms in the hip area, which would implicate a labral tear or possible defects in the articular cartilage. This is the quadrant test. For this test, I'm going to be standing behind the patient while he's sitting on the examination table. This test could also be performed standing up. For this test, I will place the patient in an extended spine position while simultaneously side bending them and rotating them to the involved side while providing a compressive force through the shoulders. A positive test would be a reproduction of the patient's symptoms. This would imply radicular symptoms would indicate compression of the intervertebral foramina that impinges the lumbar nerve roots, and local pain would indicate facet joint pathology. This is Gainsland test. For this test, the patient is going to be lying supine. For me, as the examiner, I'll be standing to his side. For this test, the patient is going to hold their flexed leg in this position while I bring their leg off to the side of the table. While stabilizing the patient, I am going to provide a force down on the hip into extension. A positive test would be pain in the sacroiliac region, which would imply sacroiliac joint pathology. This is the vertebral artery test. For this test, the patient is going to be lying supine with their head hanging off the edge of the table. I will be providing a stabilizing force on the occiput area to keep the patient's head stable. For this test, I'm going to be passively extending the cervical spine while also rotating the head to the side for 30 seconds. A positive test would be any occlusion, unilateral pupil changes, confusion, nystagmus, or nausea, which would imply compression of the cervical vertebral arteries. This is the brachial plexus traction test. For this test, I'm going to be standing behind the patient who is sitting in a neutral position. For this test, I'm going to put one hand over the AC joint, stabilizing the trunk, while my other hand is providing a lateral force on the head while the shoulder is simultaneously being compressed. A positive test would be reproduction or pain and or paresthesia symptoms throughout the involved upper extremity. Implications are brachial plexus neuropraxia, symptoms or radiating pain on the side opposite of the lateral bending would be a tension or stretching of the brachial plexus, and then radiating pain towards the side of the lateral bending would implicate compression of the cervical nerve roots of 2 vertebrae.